Patients come to my office terrified. They've read the stories, they have seen lawsuits, and they ask, Doctor, is MASH dangerous? The problem is not the question. The problem is that fear went really viral and explanations did not. So today let's separate myth from reality, no opinion, no lawsuits, just anatomy and biology. First, MASH is not medicine. It's a scaffolding. It doesn't treat disease. It reinforces weakening tissue. The same way rebar reinforces concrete. Let me give you this very important clarification. MASH isn't one product. It's a category. Different mashes exist. Lightweight versus heavyweight. Absorbable versus permanent. Created, coded versus encoded. One word covers many materials. So let's compare myths with reality. Myth number one, MASH is poison. The reality, MASH is inert. It does not dissolve, it does not circulate, it does not enter the bloodstream. Inflammation is different than toxicity. Myth number two, MASH moves inside the body. The reality, MASH does not float. Tissue grows through it. Collagen anchors it permanently. The sensation of movement is usually nerve firing, scar tightening, muscle contraction, and feeling is not movement. Myth number three, MASH shrinks and curls. The reality, all scar tissue contracts slightly. This is measured in millimeters, not inches. Technique matters more than material. Myth number four, MASH causes autoimmune disease. The reality, there is no credible scientific evidence supporting this. Symptoms often overlap with inflammation, anxiety, and related autoimmune condition. And remember, association is not causation. Myth number five, MASH always causes chronic pain. The reality, most chronic pain come from nerve, scar tissue, tension, anatomy. Pain can occur with or without MASH. MASH does not create nerves. Myth number six, all MASH was banned. The reality, some pelvic MASH product were recalled. Hernia MASH is different from pelvic MASH. Different anatomy, different material, different risk profiles. Myth number seven, natural repair is always better. The reality, yes, some hernia can be repaired without MASH, and we used to do a lot in Europe. Many cannot. A repair that fails is not more natural. It's incomplete. So the correct question is, what repair gives the patient the best long-term outcome? Yes, real complication exists. They can include infection, nerve entrapment, chronic inflammation, recurrence. No surgery is zero risk. No surgery is zero risk. But there are uncommon and usually explainable. So what imaging can and cannot show? CT and MRI, they show anatomy. They do not show nerve pain. Normal imaging does not mean imaginary pain. This misunderstanding causes enormous frustration. So when mesh removal is actually needed, mesh removal is rare. It's complex, only done for specific indication. It's not a routine solution for discomfort. I want you to remember this. Most patients with mesh never search the internet because they are doing well. Fear creates visibility. Success stays silent. As a surgeon, I've seen mesh succeed beautifully for millions of patients. I've also seen complication because no operation is perfect. But fear should never replace anatomy when decisions are made. Medicine doesn't work in obsoletes. Mesh is not always necessary, but fear should never decide surgery. Biology should. This is Dr. BenMaamer. Follow for clarity, not fear.